Hey guys, Dan here with Limitless Physical Therapy Specialist. I got Matt with me also. This email today is all about heel pain or plantar fasciitis. We're going to go through 3 quick tests you can do to check your range of motion, and then we're going to do 3 quick exercises to help improve those problems if you have them. So Matt's going to help us out here, and I'm going to just talk through these with him just like he's a patient in the office. So Matt, I'm going to have you come on up on one knee here. We're going to check your ankle range of motion. So normally how we do this is we'll take one hand between the wall and his big toe. And then Matt, I'm going to have you push your knee forward, keeping your heel down. And he should be able to bring his knee all the way up to the wall that way as he works that back and forth. So if you can't do that, it's a good chance you should work on this as an exercise, or we'll show you how to treat that. Another really common problem for people with heel pain is they end up with a really stiff big toe. So Matt, I'm going to have you go ahead and curl your toes up against that box. And most people should be able to really comfortably get their big toes smushed all the way up against the wall or the box like that, and then be able to lean their knee into that a little bit. It might feel a little bit stiff, but you should have that much range of motion for kind of normal functional activities. So awesome. Matt, go ahead and lay on your back now for me. One of the problems that a lot of people have that they don't realize could be causing their heel pain is a nerve that comes from your back all the way down into your heel. So go ahead and lay all the way down flat for me and grab behind one knee. So Matt right now, as he pulls his knee in, he's going to go ahead and straighten his leg up and flex his ankle back a little bit. And so what that's doing is putting some tension to that sciatic nerve that comes all the way up into the heel. So that's one side, and then he can switch into the other one and compare it from side to side. So maybe the ankle you're feeling pain on has less range of motion than the other side because that nerve's a little bit tight. Okay, awesome. So we're going to go ahead and switch gears here. You can sit right up on the end of the table. So the way we kind of stretch that nerve a little bit, I've got just a rubber band here, a big resistance band. You could use that or even use a belt or a strap at home. So Matt's going to really work on sitting up nice and straight, and then he's going to pull the band back and stretch his ankle back. And you'll see he's feeling a big stretch all the way up the back of his leg into his heel. Kind of the way we would do this the wrong way is if someone were to really slouch their low back, that kind of takes you kind of lose the benefit of the stretch that way. So you want to sit up straight, try to keep your knee pretty straight, and work your ankle back and forth. And you could do maybe 2 sets of 15 like this before a given activity. Awesome, great job, Matt. So go ahead and switch back up to a kneeling position facing the box for me. Another great ankle mobilization here you can do at home. I'm going to give that to your ankle, Matt. You got it. So we're just, because of the camera, this is how we're set up, but you could anchor a resistance band to something at home, like a table leg, or have someone hold it for you. And then Matt is going to work on that ankle range of motion. So as he's leaning into that stretch, the band is giving him a pull back. It's just called a mobilization with movement is how we describe this for our patients. Same thing, you could do 2 or 3 sets of 15 or 20 on this. It's a great way to improve your ankle range of motion or make a sore ankle feel a little bit better. All right, awesome job, Matt. And then the last thing we're going to do is a way to provide a load to the plantar fascia and the tissue that comes all the way up into the heel bone. So Matt's going to stand up here. We're going to just take a picture of him doing a calf raise. So the important part to this is his toe has to come into extension. So before he even starts, you can see his toe is already lifted up a little bit. And then as he presses up into his heel raise, his toe gets to that end range. So what this does is it makes sure we put a specific load on the plantar fascia where it inserts into the heel. This one could be done in 3 sets of 10, but you might need to work up to that number based on how strong your calves are when you start this exercise. That's all for today, guys. Thanks a lot for watching, and keep your eyes out for our next email. Thanks.